there, I'm Shannon Piggott with Breed Specific Healthcare, and this edition of Ask the Expert, we have Dr. Nan Boss with Best Friends Veterinary Center here to answer some questions about how to implement breed-specific wellness in your hospital. So concerning mixed breeds, how do you handle mixed breed dogs and of course mixed breed cats in your hospital?
Many times, especially with the designer breeds, we know what those breeds are that make up that dog, and we can go ahead and go over risks for both things. When I started doing ECG screening, we thought that was kind of, boxers were pretty much the same as a Doberman or any other breed with their DCM, but come to find out boxers have their own specific DNA defect that causes acute ventricular dysrhythmia syndrome, AVDS. So we can do a genetic DNA test for that disease, but that is a dominant gene. So if that dog is half boxer or even a quarter boxer, there's nothing to say that they can't also be susceptible to that disease. When you get a mixed breed dog that comes in from a shelter, a boxer mix looks a lot like a pit bull mix, looks a lot like a Manchester Terrier mix. So what we like to do is DNA test them and find out exactly what breeds that dog is made of. So the test that we like is the Wisdom Panel. It's a blood test that we draw the blood, send it in for the client. We get results in a few weeks, and that will tell us what breeds that dog is a mix of so that we can figure out what risks they might have to their health because of that. If the client can't afford to do that, then we're usually basing our recommendations on size and conformation. So bigger breed dogs, regardless of what breed, are going to be more prone to hip arthritis. Smaller breeds are going to be prone to periodontal disease. And so we can kind of get some idea of what would be the most important things to discuss with the client. Conformation is the shape and structure of the body. So some breeds like Chows have a very upright, straight back leg, and they are prone to torn ACL ligaments in their knee. It doesn't have to be a Chow to have that straight up and down leg. I can just look at that dog and say, ooh, the way your leg is built is going to make you more prone to tearing that ligament in the knee. So I need to talk to the client about that as a risk factor.
Thank you for dialing in to ask this expert. Dr. Boss, thank you for your time and for your insights.